Welcome back. In this module, we'll be covering the very important aspect of healthcare waste management. Hopefully, storage and treatment. This module
Yes, good afternoon, Snehal. How are you? Am I audible to you, Snehal?
Yes, sir.
Okay, fine. We'll wait for
Good
another 5 minutes time and we'll start. Right? Let other
Yes, sir. Yes, sir.
participants join.
Yes.
Yeah.
Yeah.
Okay. Can you see the screen?
Yes, sir, I can.
Okay. Right. Oh, how will you pass me? झालं बोलणं झालं ना जातो मी आले दोन काढून मी आम्ही करून लागेल Snail, did you attend the last lecture? Last lecture? In the last
For environment, no, sir, but for management, yes.
No, in fact, I'm taking environment only. So I just because last time I've shown few videos on this thing on AI in healthcare. You know what is AI?
Yeah, AI, I know, artificial
Right,
intelligence.
right. So even I'm not able to recall who was there, but again, some girl student was there. So we you didn't saw that video, na? AI
No,
video.
no, no.
Because in line with the last session, I was planning to what go ahead, but anyway, it doesn't matter. This topic is a bit different than AI, healthcare based. We are going to discuss. Two
Okay.
minutes time, we're going to start.
Okay.
Everyone has been talking about ChatGPT for months. It has passed law, business, and medical exams. It qualified as a level 3 coding engineer.
Snail, I'm facing certain issue. I'm not able to put my video on. So I'll do one thing. Yeah, just a minute. Now it is possible. Fine. Just a second. Snail, I'll do one thing. I'll leave and I'll try to rejoin again. Okay? Because I'm not able to put on my video. I'll leave and I'll join again. Okay.
Okay.
Within seconds.
వాటర్ హెల్త్ ఉంటుంది మలపాలతో మళ్ళీ వస్తుంది
Recording in progress.
Yes, sir. I've joined again. Can you see the screen now? Can you see the screen?
Yes, sir.
Okay, fine. Good. Just a minute. I do not know why I'm not able to put on my video.
Sir, you can also share us the link in the chat box.
Yeah. Well, in fact, I think there is certain internet issue. Last time it didn't happen. Anyway, how many sessions you have attended up till now, Snail?
I think only 2 sessions,
Two sessions.
like micro environment and micro environment. That
Okay, that session you have attended. I think we had more than 3 sessions up till now. I think
Yes.
I think you missed out only one session. That was
Yeah,
on
last one. Yes.
last right. So today, what we're going to discuss is on healthcare. This is part of Unit 2, environmental safety, right? Last time I discussed syllabus also. I'll retry to share it with all of you again. See, it is available on our platform. This the entire syllabus, right? So this is a syllabus. These are the learning objective, and this is the course outcome. I have already narrated this to the students who were present last time. Okay, so course syllabus, it includes unit 1 as introduction to healthcare and hospital environment, which I tried to cover up most part of it. And then after that, we have something on unit 2 called as environmental safety. This is what we are going to discuss now, environmental safety. Now here the meaning of environment is not the environment around us, like we have trees, plants, right? earth or playground, then we have rivers, lake. That environment is not the exact meaning what we are talking over here. Environmental safety means hospital environment safety. Here, the meaning of this word is hospital environment. Now, it includes what? It includes the entire hospital building, surrounding of the hospital, periphery like the boundary wall and all. That entire setup forms the environment of the hospital. It includes the cabin of the doctors. It includes the OPD, right? It includes the ICU. It includes general ward. It includes storage room where your medicine and all other things are stored. Yes. Good afternoon to Das Gupta. Yeah. Das Gupta, can you introduce yourself? Is it the first time you are attending?
I think, sir, one class I have attended
One class.
previously.
What did we discuss in that class? Can you just recap the thing so that
Sorry, sir, I forgot.
how shall you forgot? Okay.
Pa-
Anyway, I think there are a few newcomers also. I'm not sure. Anjali is there. Snail has attended few classes. Then
एक ते दोन कधी पण लिंक येते
Anjali is there. Yeah, you have to unmute yourself. Mute yourself. Sorry. Hello. Just a moment. Yeah, just a moment. So whatever you can recall, see, I'm this question is for all of you, so that I can make out how many class sessions you have attended, and it becomes easy for me to take the session further, right? So Snail has already briefed me out. She has not attended the last session. But anyway, irrespective of that, we are going to start. We have started with a new topic, and this topic is related to Unit 2, which is environmental safety. And as I told you, that environment over here does not mean the environment, the entire environment, which we usually talk about. We talk about what environment pollution, right? We talk about trees, plants, lake, ocean, right? River, as I said. Here, environment safety, we are talking from the point of view of hospital and healthcare. Whatever environment is prevailing over there, as I said, it can be in terms of the entire building and the boundaries of that particular hospital. Is the environment of the hospital, and keeping that environment safe from the patient point of view, from the visitors point of view, from the healthcare workers point of view is very essential and important, because as it is, the patient, they are already in trouble, they are suffering, and because of this environment, they get certain injuries. We'll be talking on that. They are not comfortable, then that is not going to help in recovery of the patient. Okay, so let me share this slide with you. Yeah, here in environment, we talk about healthcare waste. Healthcare waste, all of we know. Waste we know it is generated at our house also. It is generated in our offices, in organization. Similarly, in hospital also, waste is generated, but that waste is different from the waste which is generated at our home or at our house or at our office, at our or at the organization or in the organization where we are working. So it can be bank, it can be hotel, it can be educational institute, plenty of different.
Sir, is it biomedical waste?
Yeah, here we are talking about biomedical waste. Exactly, good. So here healthcare waste means biomedical waste. So healthcare waste is all the waste generated by a healthcare facility, medical laboratories, whatever pathological laboratories are present, and biomedical research facility. See, even many hospitals, they do have the section for research or particular area MR or committed to do only research. So, as well as waste from minor or scattered sources. Although hospital produces the bulk of healthcare waste by volume, there are a small fraction of total number of sources. Improper treatment and disposal of healthcare waste poses a serious hazard. See, if it is not disposed of properly through proper channel, then it possesses a serious hazard of secondary disease transmission diseases can get transmitted through this waste again, and due to the exposure to infectious agents among waste pickers. See, the person who's going to pick up this waste, the disease will get transmitted to those person, the waste worker, the personnel who are working on this waste, to getting it disposed of properly. Healthcare worker and even patient may get infected because of this healthcare waste. It is also called as, right, somebody has rightly pointed out, it is all Das Gupta, right? That it is also called as biomedical waste. So, what are the different types of waste? Let me show you another slide. See, there are basically three types of waste: biomedical or medical waste, which is generated in a hospital. They are segregated or categorized in four types. First is infectious. COVID we have seen, right? COVID waste was infectious waste. In fact, PPT was personal protective. Those gears were
PE,
used, right?
equipment.
Equipments, right? Those were PPE, right? Was used, and many a time gloves and all were disposed of because they were infectious. They could cause contamination, they could pass on the disease. So infectious is one type of category of waste. Hazardous waste. Hazardous waste means what? Can anybody explain me? See, here is what hazardous waste means. Hazardous waste is anything that has ability to affect human in non-infectious way. It is not transferable. It doesn't get you don't get caught of that particular disease, but it is non-infectious. This can include things like chemicals, like medical and industrial, old drugs and sharp needles होते हैं जो आपको चुभेंगे, तो उससे कैसा होता है कि it might cause you serious injuries. These are hazardous waste. And radioactive waste is the third category, which is produced by nuclear medical treatment. It is usually X-ray machines are there, then radioisotopes are there, which are used in the treatment of cancer. This comes under the category of radioactive waste. These are the four basic, and the last one is general category, which is usually generated at our home, at our office. Says so. Is called as general waste. Yeah, PPE, right? Personal protective gears, or what did you call it? It was what? PPE stand for what? Somebody has raised the hand. What is this?
So, I want to ask a question.
Yes.
What will be the radio waste generated in the hospital? Like,
Yes, it is like, see, in cancer treatment, many a time what they are given certain therapy, right? It is and even for X-rays, it generate lot of radiation. So
okay,
those are categorized as radioactive waste. So whenever the doctor is going to take your X-ray, they wear a protective shield on their body so that those rays, gamma rays, and all sort of other rays do not penetrate their body. And continuous exposure to this type of waves.
The lead jacket.
Pardon me?
Lead jacket. Lead jacket.
Lead jacket, right. So those clothing, not exactly clothing, I would say, those protective things are usually put on by the doctors or the technician who is taking the X-ray, because they are continuously exposed. So this falls under radioactive waste, right? Chemotherapy. When we talk about cancer patient, chemotherapy is one of the therapy where they are exposed to radioactive waste, not waste, radioactive rays. So this falls under radioactive waste category. So whatever equipments or whatever things that are exposed to this type of rays are usually disposed of in a separate dustbin, or they are disposed of separately. Equipment, yes, Das Gupta. I was not able to recall equipment. Personal protective equipment. Good, fine. Radiologist, TLD badge is must for all the radiologists. Good, fine. So these are what you can call it. Generally speaking, the waste are segregated in these four types, and they are disposed of separately. There is procedure which is written in the hospital, that where should they be disposed of, how should they be disposed of, who will be taking care of which type of waste. all these things are well planned, well decided, and accordingly this waste will be disposed of. So before we move ahead with another topic in this particular unit, I'd like to show you one small video. It's a hardly 5-10 minutes time video, which will actually show you how this waste are produced, where they are produced, and how they are disposed of. Just I'm going to share the video. Just let me know whether you can see it properly. After that, I'm going to take you to AI, because last time we were talking about AI's role in healthcare and hospital. So we had seen various what tools and equipment that has come into picture, that has come up to assist the doctor to make the healthcare system more effective and more efficient. Now here is one video on not this one, just a second.
The COVID pandemic
This video, particular video, yeah, here it is. Healthcare waste management. Just a minute. Yeah, I'll reshare this thing with share sound and optimize for sound clip. Okay. Can you see the screen?
Yes, sir.
And can you hear the sound as well?
No, sir.
Just
Welcome back.
now.
In this module, we'll be covering
sir.
the very important
The noise,
aspect of
the
healthcare waste management.
The volume, the sound. Just
No, sir. Video is
Hopefully,
not playing. It
after
is
this
just paused.
module, you'll be able to
Now, can you
distinguish
say-
the healthcare
No,
waste
no, sir.
category
just I'll
You
try to-
pause, sir.
I'll try to reshare it. Try to reshare it. Now just tell me whether you can hear the sound.
and their respective risks.
Yes, sir.
Okay, fine.
You should
Now see, watch this video carefully, and at the end of this video, I'll be asking you few small questions. Okay.
also know how to improve healthcare waste management, especially regarding segregation, storage, and treatment. This module is quite short, so we'll also give indication where you can obtain more information and further training. First, and above all, you have to realize that healthcare waste comes from many sources, including major sources such as hospital, clinics, and laboratories, but also minor sources such as doctor offices, dental clinics, and convalescent homes. If we look at healthcare waste amounts and composition, what is most important to know is that only 15 to 25% of the healthcare waste, only this fraction, is actually hazardous. The rest is actually like municipal solid waste and can be treated as normal municipal solid waste is treated. So what is most important is to segregate this hazardous fraction from the rest, because it is this part that needs special treatment. Here is a list of categories of hazardous healthcare waste. For instance, sharps. That's needles and syringes, but also blades. Then there is infectious waste, blood, body fluids, or infectious cultures. Pathological waste, which includes human tissue, organs, or body parts. Pharmaceutical waste, which obviously are pharmaceuticals. Then there is chemical waste, reagents, disinfectants, solvents, but also batteries or thermometers containing mercury. And finally, radioactive waste, from radiotherapy or from laboratories. Implementing a comprehensive segregation system involves knowing how to distinguish these various fractions and then setting up a system to be able to store these separately. Here is one example of color coding on bins and containers for these different healthcare waste categories. You see the infectious and the sharps typically color coded with yellow and the normal waste with black. This is also shown in this table by WHO, where recommendations for color coding and types of containers for the different categories are given. Let us take one look at a specific case of sharps. Sharps is one fraction with a high risk, mostly for healthcare workers, waste workers, or sometimes even users of recycled injection equipment. Here are some examples of sharps containers. They must be closable, puncture resistant, and leak proof on the sides and on the bottom. They should be accessible, always maintained upright, and not allowed to overfill. Also, they should be labeled or color-coded, labeled even with a biohazardous symbol. In one example, you even see a container that is suitable for direct treatment in, for instance, an autoclave. Now let's look at healthcare waste treatment. Healthcare waste treatment systems are commercially available today. The choice of technology depends on the characteristics of the waste of the healthcare facility, the capabilities and the requirements of the technology, environment and safety factors, as well as cost. A good overview is given in this document from UNEP on technologies for treatment and destruction of healthcare waste. The most common types of treatment technologies are autoclaves, hybrid steam-based treatment systems, or microwave treatment technologies. Then there is also dry heat treatment technologies, where waste is heated up by conduction or thermal radiation. This requires higher temperature and longer exposure times than steam-based processes. They are commonly used to treat small volumes. Then finally, there is of course also incineration, there is chemical treatment, or options for special landfilling and disposal. Here is an example of an autoclave system in Senegal. Or here another example from Tanzania. In this case, this shows a gas-powered autoclave. Then there is also incineration. One simple incineration system is the De Montfort incinerator, as a cheap but effective incinerator which can be built in almost any developing countries. It reaches the criteria of a temperature above 800 degrees with a residence time of over 1 second. Despite that they've been designed to be simple and affordable, we still have to think of appropriate location and using the right materials for construction. Guidelines on how to construct, use, and maintain such an incineration unit can be found online. The incinerator should be built at a convenient distance away from buildings so that any smoke or gas does not enter the buildings. 150 meters is the suggested minimum. So now, how do we go about to set up a system, for instance, at a hospital? First of all, we need to take into account the legislative framework. We also need to assign responsibilities and duties, find financial arrangements. But also, we need to start by knowing our situation through monitoring and an assessment. Based on that, we can then develop a waste management plan and implement this through appropriate infrastructure and, of course, with an intense development of awareness through respective campaigns. On the other hand, if you are active on a city level, your concern will not be at the facility itself, but how to organize and coordinate a system inside the city which is able to manage healthcare wastes from different sources. The aspects of segregation will happen at the healthcare center itself, but then how to organize transport and treatment might take different pathways. For instance, if the healthcare facility is large, like a central hospital, then treatment can happen at this same location. On the other hand, for small centers which are distributed all throughout the city, it will probably make more sense to set up a collection and transport system and then have a semi-central treatment at one larger facility or even a central treatment at one specific location in the city. So to summarize, in this module, we have looked at healthcare waste, its different categories and risks. We have discussed aspects of segregation at source, specifically also the site storage requirements. Then we looked at some examples of treatment options and then concluded by describing some elements of planning for healthcare waste management at the facility itself, but also taking an overall perspective on how to plan for a citywide solution. If I have
Yes, that was all for this video. Now, can you just tell me what sort of color are used for what sort of waste? In fact, I have narrated you four category of waste. Right? Hazardous waste, then we have biohazard, then we have normal, and then we have
Plus,
chemicals.
red is for plastic type, sir.
It is for plastic type. What about
Red is for plastic,
okay,
plastic or latex type.
okay. What about other types of waste?
Black is for office waste. Black is for paper type office waste.
Right. Black is for normal waste, office waste. We also call it as
Yeah, yeah.
office waste, right? Which includes
Uh,
tiered paper.
Yellow is for, I think, body parts or body cut parts. Something.
Infectious and sharp.
Infectious and sharp. Good.
Yeah.
Sharps and
Right.
infectious types, right? And brown was for what? Brown was for chemical, right? Chemical hazards. Whatever chemicals are being used. So this is the hospital may adopt their own coloring system also. It is not at all mandatory that you follow. But RAID has Das Gupta has said many a time RAID is used to dispose of bio waste. Bio includes means what? If operation has taken place, then whatever blood stains are there, right? Then a certain body part, if that is removed, is usually put in red because red signifies dangerous, right? Yellow comes as a hazard, right? It can be sharps and other pointed objects which are to be disposed of. And black, rightly said by Das Gupta, is normal waste or office waste, and brown as chemical waste. Okay. Now let me take you to another topic on this particular unit only. This is related to, and we'll be seeing a few more videos, short videos, so that our concept get clear. Okay. Now this one, just a minute. Let me take you to. Let me take you to. Yeah. Can you see the screen?
Yes, sir.
Okay, good. See, there's a problem with my video. Anyway, next time I'll try to fix it up. Earlier it didn't happen, but that button has got freeze. Start video जो button आता है, it is not operating. But anyway, this is again part of unit 2, that is environmental safety. Here, this unit talks about noise. See, this is part of our syllabus, but the things are very simple. In fact, we know what nuisance noise plays in our life, and particularly hospitals. Hospital has to be very careful when it comes to noise because we all know patient they need plenty of rest. They need to have sound sleep for faster recovery, and sound is one of the nuisance which brings hurdle, which brings a lot of pain if the noise is very loud and unbearable, and so noise has to be taken care of properly. What are the major source of noise in a hospital? It includes alarm, fire alarm, or any other alarm like what emergency alarms are there. Television, if they are installed in the visitor area, rattling trolleys, the trolleys which carries medicine or the patients, ringing phone, mobile phone nowadays, mobile phone are a big nuisance, right? Everywhere, as well as staffs, visitors and patient conversation. Patient भी आपस में बात करते हैं, तो which disturb the patient who is taking rest. If it is a general ward, particularly talking about. If it is special room, then fine. But visitors again, they are. That's why visitors hours are fixed. Because when visitors visit the hospital, it creates plenty of noise. Even the staff member, they also, in their conversation, they have to be very careful that they are not disturbing the patient and the healthcare workers. Because clean drop silence is what is expected in ideal hospital. But still we know noise is going to be generated because of all this activity. Okay. So why noise is prohibited in a hospital? We all know. I just now I explained you. The scientist says that excessive noise in hospital reduces the intelligibility of speech and impairs communication, causes annoyance, irritations, and fatigue, and reduce the quality and safety of healthcare. Right?
Sir, are you sharing PPT
Yes, PPT. What you see?
video
No,
window?
no. I'll stop sharing and reshare. Just a minute.
Okay.
I thought you were able to see that video. Anyway, I'm going to reshare it. Yeah, this was the first slide which I have discussed about.
Yes, sir.
Now can you see the
Yes, sir. Yes, sir.
this is what I've discussed just now. Causes of noise. We all know this. It's a very general question. We know from where the sounds or noise, not sound. Noise is what? Noise is something which disturb you. Okay. There are plenty of sources or causes from where noise is generated, and why noise is prohibited. See, you can see board outside the hospital. Blow no horns, right? You are not expected to blow your horn on the road adjacent to a hospital. Even such type of board you can see near schools also, schools and colleges, because this noise, causes a lot of disturbances. It reduces the quality of conversation, right? It brings irritation, it brings fatigue, reduces the quality and safety of healthcare, right? Because patient, as we know, requires lot of rest. In fact, they are at rest only 24/7, most of the patient. So if they get rest properly, then their chances of recovering fast is increases. They will recover quickly compared to if they are not getting sufficient rest. So this is a very general questions, the answer which we all know, right? Now, what is the level of noise level which is acceptable in the hospital? The World Health Organization, that is the WHO, recommend that hospital noise level should not exceed 34 decibel, right? It is measured into decibels, right? 35 decibels during the day, and at the night it should be reduced to 30 only. I mean to say, in noise, pin drop silence is what is expected in night, and in daytimes all you can expect is 35 decibels. How does noise affect patient in hospital? Now, again, very common question which all of you can answer. See, apart from whatever is written here, more noise exposure can create, or even a mild noise level has been linked increased level of stress, increased heart rate, higher blood pressure, and poor mental health. Apart from this, what else noise affects? Can somebody in the group tell me? If there's plenty of noise around, what is going to happen in a hospital? I'm talking about hospital and healthcare facility. See, it is going to affect not only the patient, but it is going to affect the healthcare workers, including doctors, including the nurses, including the staff, right? admin department. So they are all going to get disturbed. So noise level has to be very, very low when we talk about hospitals. And yeah, healthcare based we have already covered up. So I'm going to show you one more video on AI. How all of you know Chat GPT has been talked about much recently. Chat GPT, then Bard is there, then Bling is there. So these all are helping the healthcare facility and hospitals in bringing efficiency and effectiveness. Earlier session I've shown various tools and various gadgets that are available. AI gadget, I talked about AI gadget, and trends, AI trends we have talked about. Basically, people have missed out that session, but anyway, you can see the recording. One more video I'm going to share with all of you, which is going to talk about Chat GPT and its role in healthcare. Okay, not directly related to this particular topic. It is related to the earlier topic which I have discussed in my early session. Just a minute. Due to noise, stress level, irritability, and then fatigue may happen. Yes, that's Gupta, you're correct. Okay, now I'm going to reshare it again for the video. Stop sharing. I'm going to reshare. And see, again, remember, I'll be asking you few questions at the end of the video. Okay. Just a minute. Yes, I hope all of you can see the screen.
Yes, sir.
Okay, good. Again, watch the video. I'll be asking.
Everyone has been talking about ChatGPT for months. It has passed
This particular topic, you can correlate it with the unit one. Okay, just a minute.
law, business, and medical exams. It qualified as a level 3 coding engineer at Google. It outperformed students in microbiology, and the list goes on forever. It even reached 100 million users in 2 months. It took TikTok 9 months to reach the same level of users. It's extraordinary. Plus, it's a breakthrough moment. For years, I've been talking about the importance of AI becoming the best assistance we could have ever dreamed about, especially when it comes to medicine and healthcare. Now it's here. You can use it every day to learn to work with it, to learn to write better briefs and prompts, in general, to learn to work with AI. Even I have become a pro user and I use ChatGPT daily. I cannot tell you how much time it saves me every single day, and also how better I have become in the last couple of months, writing briefs many times every single day. So I thought, let's just summarize what we can expect from this breakthrough technology when it comes to healthcare. Here are 6 things to expect from the next year about ChatGPT. Number 1, AI tools will not be credited as authors of scientific publications. When ChatGPT was released in November 2022, the first studies started coming out weeks after that, and ChatGPT, at least in 3 studies, was listed as a co-author of the paper. There was a huge scientific debate, and finally, the major publishing groups like Springer came out with the announcement that ChatGPT and such AI tools cannot become co-authors of papers because these tools obviously cannot take responsibility for the content that these provide. So don't expect ChatGPT and AI in general to become co-authors of studies, but very much expect researchers around the world to use ChatGPT to write abstracts and parts of the text, but they will have to mention that very clearly and transparently in the acknowledgement section. Number 2, medical alternatives of ChatGPT will arrive. Just weeks after ChatGPT was released, Google announced, of course, its own ChatGPT-like tool, Bard, coming out. And Bard has a very similar chatbot that the Google engineers developed that was based on medical data and databases. It was called MedPalm. Even a study came out at the end of 2022 about that, detailing and describing all the things that matter about this medical alternative. Just imagine using ChatGPT for medical purposes. You can ask certain questions like help in administration, or write an email or a social media post for patients. But when it comes to a real medical chatbot that was trained on medical data and medical interactions, It's a different scenario. It means patients could turn to these chatbots to find and get reliable, valuable information. Physicians could use these chatbots to gather pieces of information from all the studies that they cannot check out physically because there are 32 million studies out there on PubMed.com, the major database of biomedical literature. So expect to see medically trained chatbots coming out soon. Number 3, doctors will see mayhem when patients come with information they received from ChatGPT. For the last 2 decades, physicians have been complaining about patients arriving after Googling their symptoms online. But of course they do. Every empowered patient is active online. They want to obtain data and information to better understand how to contribute to their health or disease management. But in that case, they will come with data, information, pieces of advice they received from ChatGPT-like tools. It's a mayhem, so we will need some time to learn the tricks about dealing with patients coming with ChatGPT-derived information. We will have to see how physicians can manage the expectations of patients about the information they get from AI, and how to become the guides for those patients in the jungle of not just information, but even AI-based medical tools. Number 4, where are your sources and references, ChatGPT? It's very important that when you find medical information online, the best, most reliable medical websites indeed list the sources, the references they base their information on. When you do the same with ChatGPT, you find nothing. You get the response you need, which might be reliable or not, but you don't see what kind of references the information is based on. Now you can proactively ask for that, like you have a medical question, you get a response from ChatGPT, and then you can reply, please cite and list your resources you base your information on. And it will give you a list of resources. So we all have to level up our skills about being able to verify information, even if we can get the actual list of resources from ChatGPT. Number 5, using chatbots will become a part of every medical curriculum. I've been teaching medical students about AI, the dangers, the importance, the methods of artificial intelligence for many years. And now I also teach them about using ChatGPT, because it can indeed be the best assistant a physician can ever hope for, if they know how to use it, if they know how to verify information, how to get the required list of resources from ChatGPT, if they can write better and better briefs and prompts. There is one more issue related to that. Written assignments. I require students to write science fiction short stories about, for example, a medical technology going berserk 10 years from now, to make them think about the future, the ethical, social implications. Now I have to use other AI tools that compare the assignment they sent in to literature and the internet in general, and tell me what's the percentage, what's the chance that that assignment was written by AI or just humans. It's a very important piece of information, but it means for us educators, we have to come up with even more creative ways of making students fight for their good grades. Before moving to the next point, let me just mention that we published a course, Introduction to Artificial Intelligence in Medicine and Healthcare at the Medical Futurist. It's a digital course that mentions everything that matters about AI. Definition, levels, methods, advantages, dangers, everything that's related to medicine and healthcare, even when it comes to tools like ChatGPT. And number 6, our final point, we will see a healthcare company implementing ChatGPT into its service. It would mean that I think a healthcare company, probably in the US, will start using ChatGPT as a part of their service, whether for scheduling appointments or writing marketing emails and social media posts, or being able to have a discussion through a chatbot with the patient before even having the first appointment. But ChatGPT will be the integrated part of a service of a healthcare company in 2023. So these are the 6 points, 6 trends I expect from ChatGPT. But in the meantime, we can do at least one thing. Please go to ChatGPT, start writing briefs or prompts, even just for fun reasons. But we all, working in healthcare, we all need to learn how to work with AI. And this breakthrough technology finally gives us an opportunity to do it in practice. If you like this video,
Yeah, Das Gupta has requested to share the link. See, this was the general video of the nuisance as well as of the what? Just I'll put it in the chat box, the link. How this particular AI, because see, this was in line with the last session where I left. That's why I've shown this video. See, this particular AI is what helping the healthcare as well as it is causing trouble also. Now, can you tell me? It was narrated in a video that this Chat GPT is apart from its advantages, it is possessing disadvantages also. Now, can you tell me what were the advantages that were discussed in the video and what were the disadvantages? First of all, I'll stop sharing and share with unit 3. Just a moment. Yes, what are the advantages of this particular AI for the healthcare and what are the disadvantages?
So the advantages is been like doctors can see the patient history before the patient is coming. Then they can explore the medical research in no time. Like they don't have to read all the medical data.
Yeah, they can work on the research paper, research article,
Yes,
because those are written by the healthcare or doctors, particularly when they attend conference on any particular topic. So it's going to assist the doctor in preparing those research articles. We call it research articles, right? That is
yes,
good. What else?
yes.
What else?
Before coming to the doctor, the chatbots can take the appointments and
Good.
initial documentation they can do.
Exactly. Good. Excellent. And what were the one major disadvantage he has discussed? That YouTuber.
Disadvantages like disadvantages like it can be used for uh, they have to send a reference if anybody is writing the research paper, then GTP research will not be valid. Like they cannot take the responsibility of the what is published.
Exactly.
We
ChatGPT
cannot follow blindly on ChatGPT.
exactly,
I
because
think.
it comes under plagiarism, AI plagiarism, right? And it can get caught. That is what he was explaining.
Right,
Yeah,
right.
he has to cross check out the students' assignment which are submitted, right? So and it cannot be included as an author. Yeah, Anjali, you want to say something?
Yes, it will be hard to deal with patients who are very, very pre-informed through ChatGPT.
Good, excellent. This was the second point which he has discussed. Mayhem. He has used the word mayhem means
Yes, there have been
chaos.
absolute mayhem. Yes, sir.
Yeah, mayhem. So mayhem is what the patient is overloaded with information. He's doing research on his own. He's making his own assumption, own hypothesis. He's drawing own hypothesis and trying to treat self treatment जो बोलते हैं, which is not recommended, which is not advised in healthcare. When it comes to severe diseases, ठीक है, आपको सर्दी खांसी जुकाम हो गया तो you can take medicine on your own because those are very general diseases, common diseases. But when it comes to critical diseases, there also nowadays what patients are doing, even their relatives, they are searching on net, they are searching on Chat GPT and trying to get a solution on their own. So when the patient is admitted, he is admitted with a biased mind. कि ये ऐसा ही होना चाहिए. And if the treatment is done something else, if the doctor treat them differently, then they feel like the treatment is going wrong. So that mayhem is happening in the hospitals nowadays because of this overload of information, isn't it? Even we googled out everything nowadays. It is fashion, not fashion. We are habitual. Even if you go to purchase anything, like for example mobile or a television, you will google out. First of all, you will search on net what are the prices, what type of model are available, what are the reviews given by the purchasers, right? People who have already purchased and people who are using that product. The product can be anything. It can be, as I said, electronic equipment, gadget. It can be kitchen utensils. It can be anything. It can be apparel. It can be your clothing, right? So the patient, what they are doing, and the relatives particularly, they are searching on the net. They are searching on chat. They are asking questions to Chat GPT, and it is possessing as a disadvantages to the doctors who are treating the patient. isn't it? So good
Yes.
examples. Yeah, fine. So
And sir, also, it may happen in future that the GPT will see your case and diagnose what is going on. Because recently at MIT, one application was discovered, which will, after scanning your X-ray, it will say that it is cancerous or not non-cancerous.
what I've shown in last session, those equipments there are pods also small very micro level equipments which will
Yeah.
go which will be drained in your blood, and they will detect the source of disease,
Yes.
and they'll cure the disease there and there itself. There will won't be need of cutting
Yes.
operations will go away, because this boats will be there in your body, very micro level equipments which are going to treat. This is what we have seen. X-ray again, even
Yes.
touch your skin. There are equipment which, if you put on your skin, will show you your BP level, then your blood sugar. All this advancement in technology is helping the doctor. In fact, apart
Yes.
from his yeah.
Even Neuralink also got the license for the clinical trials nowadays.
Exactly, yeah. So these are the all advancement which we as an we as a MBA in healthcare should be knowing about all this recent development, recent trends which are happening, and ChatGPT is one of it, because this will be now in future extensively used by doctors and patients. Definitely, you cannot stop patient also from using this type of AI, but doctor need to be very cautious that they have to keep in mind that the patient, if they have earlier gone through certain information, they should be able to extract that what sort of perception they are having about the disease, about the treatment, and they should clarify the, because you see, every time ChatGPT is not going to give you correct information. You have to be very wise. The prompt has to be correct. All of you know what is prompt. The inputs which we give in the search box of the ChatGPT, or even when we Google it out, we put certain keywords, that those are called as prompts. So if your prompt altogether is wrong, then the information which will be uploaded will not be correct. And if you blindly believe in that information, then your perception will change, and you start believing on wrong things. So that may hamper in the treatment of that particular patient, because psychologically he or she got prepared for something, and the treatment which the patient is getting is different. So obviously it is going to create a lot of chaos, a lot of confusion amongst the patient as well as amongst the doctor, because their line of treatment may be different than what was expected by the patient. I hope all of you agree with this, right? So here, actually, we end with today's session. That is, the session was on Unit 2, environmental safety. Environmental, I'll add one more word, environmental healthcare safety, right? So noise we have taken in early, in the upcoming session, we'll be talking about other things related to environmental safety, right? Any doubt, any question in this particular session? Anjali, then Snehal, Das Gupta, anything you would like to ask?
No, sir. No,
Okay,
it's clear.
fine. Thank you, all of you. Thank you so much for attending. Let us meet
Thank you, sir.
again. Yeah, thank you all. Bye bye.
Thank you, sir.
Bye.
Thank you.
I'm ending this.
Thank you.
Thank you, sir.
Thank you all.